Ladies and gentlemen, please welcome back to the stage Tracy Waring Evans.
Good morning, everyone. Again, for some of you, I see we've now filled the house. I wonder why. On behalf of APHSA and the Alliance, it is our sincere pleasure to welcome to the summit the Honorable Thomas Price, Secretary, Health and Human Services. Dr. Price was sworn in as the 23rd Secretary of Health and Human Services on February 10th of this year. He brings to the department a lifetime of service and a dedication to advancing the quality of health care in America, both as a physician and as a policymaker. Dr. Price received his Bachelor and Doctor of Medicine degrees from the University of Michigan and completed the orthopedic surgery residency at Emory University. During his 20 years as a practicing physician, he also served as medical director of the orthopedic clinic at Grady Memorial Hospital, as well as the assistant professor at Emory University School of Medicine. Most recently, Dr. Price served as a U.S. representative for Georgia's 6th Congressional District. He held this office from 2005 to 2017. During his congressional career, Dr. Price served in various leadership roles, including chairman of the House Budget Committee, chairman of the House Republican Policy Committee, and chairman of the Republican Study Committee. Dr. Price is a strong advocate for a patient-centered healthcare system that adheres to 6 key principles: affordability, accessibility, quality, choices, innovation, and responsiveness. Additionally, he recognizes the department must be efficient, effective, and accountable, as well as willing to partner with those in our communities who are already doing remarkable work. Under his leadership, HHS strives to preserve the promises that society has made to the American people. Ladies and gentlemen, the Honorable Thomas Price.
Thank you. Thank you so very much. Good morning to you. Thanks, Tracy, for those wonderfully kind and generous words. I get tired just thinking about what it was that I went through to get here. So thanks so much for all of the work that you do. I am so humbled by the responsibility that you have and the work that you bring to the table. So I can't tell you how much I appreciate it, and it really is an honor for me to be able to join you today and to share a few words. I appreciate the opportunity to address the American Public Human Services Association, and again, I want to thank you for what you all do to support our fellow citizens. Our nation's state and local government and local communities do such important work providing vulnerable Americans with the services that they need to live more enriching lives. Our team at HHS is really proud to be able to partner with all of you and support the crucial and critical work that's being done. I really have been remarkably impressed with the work product and activity that you all do. Having served 12 years in Congress, as Tracy mentioned, I can tell you that sometimes I appreciate the fact that it's difficult to get folks moving in the same direction. I know that might be a surprise to some of you folks, but it is. But in looking at what you all have done, I think it really is, it's a testimony to the dedication and the commitment that you have to the work that you're doing, and I commend you for that. Just under 3 months ago, as Tracy mentioned, I raised my right hand and took the oath to assume this office, and I can't tell you what an incredible privilege it is to hold this position as Secretary of Health and Human Services. I'm grateful to the President of the United States for this honor and for his confidence in me to be able to serve as the 23rd Secretary of Health and Human Services. I'm the 3rd physician to serve as HHS Secretary. Lou Sullivan was a physician as well, and Otis Bowen back in the day was a doc. But for those of you that have any affinity for the healthcare arena, you know that those two folks were internists, and that I'm a surgeon. So there are folks that say that's got to be a difference, right? That a surgeon coming to the table. But the fact of the matter is that we all have compassion and concern for our fellow citizen, and we're working together to try to make the goals that you have work. For me, this really feels like the culmination of a life's work. As Tracy mentioned, I spent over 20 years taking care of patients on the north side of Atlanta, Started in solo practice and grew it into a large private group practice of orthopedic surgeons, one of the largest in the country in non-academic practices. Overlapped a little bit with public service, spent 8 years in the state legislature, in the state senate in Georgia, and then 12 years in the United States House of Representatives, representing the 6th District of Georgia. So for me, this really feels, as I say, like the culmination of a life's work. And I can't tell you how enthusiastic and excited I am to be able to have the opportunity to serve in this capacity at this point in time in our nation's history, which is incredibly important, both on the health and the human services side. As a physician, I can tell you that I appreciated that there was much that happened outside of my office and outside of the operating room that directly affected my patients. That won't come as any surprise to you, either in their ability to get well or in some cases to survive. Life can send all sorts of detours our way, as you all well know, that oftentimes get in the way of healthy living. A parent's loss of work, or a devastating diagnosis, or drug addiction, or unsafe neighborhoods, or family conflicts. All of those things can imperil both physical and mental health. Now, as you well know, families are the first line providers in the human services side that can address these issues, but oftentimes families themselves need support from their neighbors and from the larger community. Physicians, doctors, will never be able to get care right for so many of their patients unless those patients are able to receive support that they need from the communities and the human services realm. Which is why I tell you it, again, is such an incredible joy for me to be able to lead the Department of Health and Human Services. Our mission is to improve the health and safety and well-being of the American people, and our job is to enable the American people to have access to both health care and crucial human services. And I believe that it's important, and I know that you appreciate that work needs to be done in concert. It ought not be at tension. It ought not be at odds with one another. And as I visited the divisions throughout the department, I know that the human services side often feels like the redheaded stepchild in HHS, and we want to make certain that they appreciate, that we understand and appreciate that on any given day, on any given issue at HHS, we're not thinking about health or human services. We're thinking about health and human services. There are 27 divisions within HHS, as many of you know. I wanted to make certain that I visited every one of those either staff or operating divisions in the early days of my tenure, and I've had the opportunity to do so. And what I have tried to lay out for folks is a passion and an enthusiasm that I have for leading this organization, but also to try to get folks to appreciate that where we ought to be putting our focus. There are all sorts of different views and opinions about how we ought to do things, but if we keep our focus on patients and people and partnerships, then we'll get to the right spot. The patients that are the end user of the health services, the people that are the beneficiaries of the human services, and the partnerships that you all know so well that must be in place in order for us to be able to provide the kind of health and human services to our fellow citizens. Incredibly important. And those partnerships, you all know, are imperative and necessary every single day. So what I'd like to do in my brief time with you today is to touch on a few priorities that I've outlined for our department, and then discuss a bit of the big picture and how we plan on moving forward at HHS. When I got to be able to fulfill or take this role, I wanted to identify some clinical priorities, some medical priorities that also have significant interface with the human services side. And so we've identified 3 specific clinical entities that we're going to try to focus on. One is childhood obesity, and you'll notice a common denominator to these 3 that I'll share with you at the end. The first is childhood obesity. We've got so many kids. We've got 60% of the kids in this country who are considered overweight or obese, 20% obese. These young people, if something doesn't change, they're not going to be health challenges for themselves and their families and communities and all of us when they're 60 or 70 or 80. It's going to be when they're 25, 30, and 35. And so we simply must address this incredibly important issue. Second is severe mental illness. We have gone a long way in this country toward, I believe, down the wrong road. Decades ago, when I was a kid, we housed a lot of the folks with severe mental illness in substandard clinical settings. And many of those individuals, in fact, probably the majority of them, if we're honest with ourselves, didn't get the kind of treatment that they needed. Over the past 30, 40, 50 years, we've traded that substandard clinical setting for the criminal justice system or the streets. 60% of homelessness in this nation, of those individuals who are homeless, estimated to have some severe mental illness. And at the same time, we're not doing the kind of job that we need to do to treat those individuals. And all of this bleeds over into the human services side as well. And then the third clinical area is the opioid crisis, which knows no bounds in our nation. It cuts across all classes, all sectors of our society, destroying lives, destroying families, destroying communities. And the numbers are overwhelming. This gray hair on my head means that I've been around a little while to witness a few things, and one of the things that I was witness to was the Vietnam War, which it happened during my childhood. We lost in Vietnam 58,000 Americans. Over 50,000 Americans. We lose here in the United States today 52,000 of our fellow citizens to overdose deaths every single year. We lose a Vietnam because of overdose deaths every single year. 33,000 of those due to opioids. You know this all too well. This is absolutely unacceptable as a nation. And we've got to get that under control and do the kinds of things that will reverse that tide. So childhood obesity, severe mental illness, and the opioid crisis. All three of those, the common theme to those is that we're losing the battle on each and every one of them. And we ought not be. So we're going to make that a focus of the department, and I look forward to your assistance as we try to move our nation in a better direction on all three of these things. Let me drill down a little bit on the opioid crisis, because the health and human services clearly come together in this arena. One where the situation we're facing across our land truly is absolutely critical, and the numbers, as I mentioned, give witness to that. You all know what kind of burdens and complications the rising rates of opioid addiction and overdose deaths have created for vulnerable Americans. Just one example, it's absolutely heartbreaking to look at what this has done to our foster care system. When the Senate Committee on Aging is holding hearings on grandparents raising their grandchildren because the parents have died of an overdose or are incarcerated or are otherwise incapacitated, we know that something has gone seriously wrong. The opioid epidemic is one of the top priorities for President Trump. He and I have had this conversation on multiple occasions. He's established a commission on the opioid crisis, put Governor Christie to lead that commission, and I'm pleased to be able to provide assistance on both the health and the human services side. A couple weeks ago, due to some legislation that was passed in Congress, we were able to distribute $485 million in monies to the states to try to focus on the kinds of correct treatment and services being provided to those individuals who have found themselves in the midst of this crisis. We've got a 5-point strategy through the Health and Human Services Department to strengthen public health and surveillance and data gathering, getting appropriate data and real-time data, improving access to treatment and recovery services, targeting availability and distribution of overdose reversing drugs. There's some exciting work that's being done in this area at NIH and elsewhere, supporting that cutting-edge research that will potentially turn this challenge around so that we no longer have the incredible numbers of overdoses and deaths. Imagine, if you will, a vaccine that would make it so that addiction doesn't occur to opioids. Exciting prospect, and it really is within our reach. And then finally, advancing the practice of pain management itself. We will continue to enlist your help and work to treat addiction before the consequences of it spiral folks out of control, and to support people struggling with addiction as they enter recovery. I know that you all have all sorts of wonderful stories, and some of you have remarkable best practices. Vermont is one state. We got some folks from Vermont, I think, here. They left? Oh, no, here we are, right over here. Good deal. You all are doing incredible work in the area of opioid treatment. They've got a model that uses a spoken hub plan where pain addiction specialists serve at the center of initially treating and communicate with the patient. That's the hub of the spoken hub. And then a team that coordinates primary care and a multidisciplinary team that goes out as the spokes and addresses the various health and human services needs for individual citizens. And this level of explicit coordination and integration has produced incredibly remarkable results in Vermont, and I know that many other states are looking to that as a model. So we want to better understand how we can support you on this issue. How can we help the Vermonts of the nation be able to successfully address the challenges? You are where the rubber hits the road on much of this, and we want to be able to help the work that you're doing. Getting this right will literally help and save the lives of many, many Americans, and it's absolutely that important to do so. Another topic that I want to touch on, a non-clinical topic that I know is of great interest and importance to you all, is the matter of gainful employment and independence. It's one of the priorities that you all have. We all know well, from both a health perspective and a human services perspective, that good health is essential in order to work and support oneself. Good health plays such an important role in leading role in a fulfilling life. But we spend less time, if you think about it, we spend less time thinking about how work can actually encourage good health. And when it comes to looking at what in our lives contributes to our health, we too often forget how big a deal work itself actually is. And there's quite a bit of academic literature in this arena. As you know, there was a recent study out of Britain that reviewed academic evidence on whether or not work is good for one's health and well-being. And their findings were really remarkable, I thought. And let me just share with you one of the conclusions that they reached. Work meets important psychosocial needs. It seems to be obvious. Work is central to individual identity and social roles and social status. Employment and socioeconomic status are the main drivers of social gradients in physical and mental health and mortality. They concluded that conversely, there's a strong association between worklessness and poor health. So if we're not designing our programs to support and encourage work, we're doing a disservice to the health and well-being of our fellow citizens. I know that all of you have been working diligently in this area. You put an incredible amount of work into this area, and I want to commend you for it. However, we simply must do a better job, and we look forward to collaborating with you and partnering with you to try to move forward on real solutions in this area. Before I close, I'd like to touch on a couple 30,000 or 40,000 foot issues, a couple of the broader issues. We're all prisoners of our own experience, and one of my experiences, as Tracy mentioned, was to have the privilege of chairing the Budget Committee in the House of Representatives. Some would say that's a real prison sentence, to be able to chair the Budget Committee at the House. But I'd be remiss if I didn't mention a couple things, and they are issues that you all know so well, and they affect the human services side and will affect it to a greater degree as we move forward. And they're demographics of our society, and the debt that we have as a nation. We're an aging nation. The demographics dictate that we will see huge challenges as a nation because of my generation, because of the boomers. There are a few of you out here. Anybody born between 1946 and 1964, I'm smack in the middle of the boomer generation. There are 10,000 of us reaching retirement age every single day, 10,000. 80 million or so moving through the system. There were, in 2010, there were about 40 million Americans who were over the age of 65. In 2050, there will be 88 million Americans over the age of 65. And just the cost to human services and to our healthcare system will of necessity increase. It's not a bad thing. It's a good thing that we have more individuals reaching that age. But it's absolutely imperative that we recognize it and plan for it. And I want to touch on one of the consequences of that. From a fiscal standpoint, our debt and our debt service is likely to have a more significant effect on the resources available for human services than any of us would care to admit. $20 trillion in debt right now. The unfunded liability, depending on who you ask, is somewhere between 3 and 5 times of that with the services that we have promised to the American people. Interest on the debt is increasing such that the discretionary funds available, that pie of resources that are available, not on the mandatory side, but on the discretionary side, which is where so much of the human services money comes from, on that discretionary side, that portion of the pie gets smaller and smaller and smaller every single year of necessity because of the mandatory side and the aging of our population. So how we solve these challenges is incredibly important. But it's clear that one thing is true, and that is that states will be asked to do a lot more in the provision of services. Which brings me to my final point, and that is our desire at HHS to partner with you, to collaborate with you in a reimagined HHS that is much more collaborative and supportive of your work. Yesterday, we kicked off an evaluation of the Health and Human Services Department through a department-wide project to identify greater efficiencies and more effective organization that will allow us to accomplish our mission regardless of the circumstances. And you can help us with this, and I want to urge you to consider how you might be able to assist in ways that you might have imagined at one point in the past, but were either told, oh, no, don't worry about that, or we got it handled. And I want to tell you that the department now is on a receiving mode. We want to receive your ideas, whether it's on regulatory reforms and changes that would be helpful to be able to allow you to do more, whether it's lowering the burden, decreasing the hurdles, lowering the hurdles, removing the hurdles to allow you to be able to do the work that you do, combining funding streams, which I think is an exciting opportunity that we all have. Providing greater flexibility, and greater flexibility is incredibly important. As I said, you are where the rubber hits the road, and you know better how to make these programs work, and assistance to individuals to get it to work much better than we do in our department. And working across departments in collaborative ways, whether it's HHS working with education, whether it's HHS working with labor, on and on, whether it's HHS working with HUD, we believe that it's incredibly important that we work together in a collaborative fashion. So I ask you, I challenge you to think creatively and expansively about how you can help us be able to assist you in doing your jobs as we all work to be certain that in our service to our fellow citizens is accomplished so that we ensure their ability to realize their dreams by enriching their lives. It's all about the 3 Ps that I mentioned: people, patients, and partnership. And we recognize, and I appreciate and sincerely appreciate the work that you do, the partnership that we have together, and the partnership that I want to have flourish together is recognized at HHS, and we want to water that plant just as much as we can. I look forward to making the most of these valuable partnerships, and through them, improving the health and safety and well-being of the American people. Thank you for the work that you do. God bless you in your endeavors. Thank you so much. Take care.